Okay, so we'll get started now. It looks like everyone's joining us. So good afternoon, everyone. Welcome. My name is Lisa Clement, and I am a program manager with the BC Centre for Palliative Care. And here with me today is my colleague Stephanie, who will be running the Zoom for us and providing technical support. The session today, Compassionate Dementia Inclusive Communities, is part of our Altogether Echo series, in which we invite healthcare providers, staff, and volunteers working in community organizations, along with individuals who are supporting people facing serious illness, end of life, and bereavement. So to begin our session, I would like to acknowledge that the BC Centre for Palliative Care works with humility and respect alongside partners across the land, colonially known as British Columbia. We acknowledge that our work takes place on the traditional and unceded territories of many distinct First Nations whose values continue to guide us. We also recognize Métis people and Métis chartered communities, as well as the Inuit and urban Indigenous peoples living across the province on various traditional territories. So our ECHO platform creates a knowledge-sharing network of healthcare providers, subject matter, and community experts to share experience and learning. We achieve this knowledge sharing through discussion and opportunities for you as a participant to share your own knowledge. So just a reminder that while we strive to create a safe environment in every ECHO session, we recognize that this may touch on personal experiences you have had, and if you do not feel comfortable sharing your name or video at any time, please feel free to rename yourself or turn off your camera. So just before we get started, I'll introduce our wonderful guest speaker today. So our session today, Compassionate Dementia Inclusive Communities, is led by Melody Jobse. Melody is the community engagement lead with the BC Centre for Palliative Care. She's been with us for 8 years, and she is also a key member of a UBCO Okanagan research team working to animate a compassionate dementia inclusive communities approach with 6 organizations across Canada. So Melody is invested in building capacity, growing compassionate communities that support people who are affected by a serious illness, end of life, and death and grieving experiences. Melody also includes advanced care planning facilitation training. She is our master trainer, and she delivers Altogether Echo series, as well as supporting community and provincial events across BC and nationally. Melody connects people, passion, and knowledge for the greater good, and it's a common theme throughout her diverse nonprofit leadership work for over 30 years. So today's presentation will be about an hour, and this will include time for the presentation and personal reflections. So now it is my pleasure to hand the session over to Melody.
So good afternoon, everybody. Thank you, Lisa. Thank you, Stephanie, for the introduction and for allowing this to be a venue for us to interact over. And thank you to each one of you who are joining live today and sharing your lunch. I see a couple of you there around the lunch table, which is exactly perfect time for this kind of an integration. I'm very grateful to be here today to represent Nav-CARE team, and I look forward to sharing this project, which focuses on developing compassionate dementia inclusive communities. I'm also noting our time together here will be an overview of the program, and we have several partner representation on this call. So happy to acknowledge their participation here too. So Stephanie, next slide, please. I want to highlight this project specifically and acknowledge Dr. Barb Pessett as the principal investigator, Dr. Wendley Diggleby as our co-investigator, and Gloria Praveen, who is our project manager, and the other members of the team, Dr. Kelly Ashford, myself, and Heather Neal Furno, and Kelly Sullivan. Collectively, we have been supported for the key knowledge partnerships, I should say, the BC Centre for Palliative Care, UBC, which is our Vancouver Building Capacity Project, Alzheimer's Society of BC, and United Way BC. Collectively, that has been the support for each one of the 6 organizations that are part of this project, specifically the Greater Trail Hospice Society of BC, Prince George Hospice and Palliative Care Society in Prince George, Rella Community Services, South Surrey, Age-Friendly Cold Lake, Alberta, Bruce Peninsula Hospice Society in Ontario, and the Newfoundland Health Authority in Newfoundland. So we are indeed representing through this project partner communities from across Canada. So I just want to start by the next slide by just even saying, what in the world is a compassionate community? And not to assume that you don't know this, but for a common starting definition and what we mean. What is a compassionate community? So a compassionate community is a group of people who are passionate and committed to improving the experiences of those living with serious illness, caregiving, and dying. A community that takes an active role in caring for people affected by these experiences. How is that done? Well, it includes connecting people to supports that are relevant for their care and quality of life. It includes raising awareness about end-of-life issues and building supportive networks. So the idea for this project came from observing many wonderful compassionate communities across Canada that are designed to create more awareness, more education, and help augment the engagement and support for communities where people are living with declining health. Now, that to say is most all of our communities. And now from observing how people, organizations, and communities banded together to make a real difference in their communities, especially in their daily lives of those who are struggling with an illness. So the initiatives of this project, while they're making a meaningful difference in the lives of many individuals, there were persons in the community for which some of these initiatives did not meet their needs. And for example, persons living with dementia, their care partners, and then highlighting the urgent need for practical solutions to support the individuals. We have also seen that interorganizational approaches to community initiatives are increasingly recognized as an important innovation, and that coming together to build capacity can better support community. So this project is really the development of what it looks like to be a compassionate community, supporting people living with dementia. Next slide. The background really is, again, we've seen many compassionate communities across Canada. There are practical solutions that are urgently needed to support persons living with dementia and their care partners. While we're making a meaningful difference in the lives of many individuals, we have seen and we know that demographically and statistically, the increase of people diagnosed with a cognitive impairment like dementia is increasing globally. In Canada, approximately 750 Canadians are living with dementia, and a number that is predicted to rise as our population ages. Moreover, every year, family and friends provide more than 580 million hours of support. That need indicates that there is a growing concern of how to address and support people living with dementia, their families, and their caregivers. So this research team that I'm privileged to be a part of developed a toolkit that outlines a practical series of steps to help implement a compassionate, dementia-inclusive approach to care and utilizing an interorganizational approach. So the focus of this session is to share with you this approach and how we have developed the approach and some of the outcomes at this point. Next slide. So with all of this in mind, we brought together what are three social movements that emphasize social inclusion, empowerment, and community initiative supports to improve quality of life for those living with healthcare challenges. So the three elements are compassionate communities, dementia inclusion, and volunteer navigation. Now, throughout the project, the goal was to learn how communities might be able to better support persons in the community. So I'm just going to take a minute and familiarize ourselves and let you see how we have defined the various initiatives here through these elements. So the first element is a compassionate community. Sorry, I was just following the slide sticking. Thank you, Stephanie. So having just shared what a compassionate community is, the compassionate communities approach that we have drawn upon is actually based upon the work of the BC Centre for Palliative Care and our development of the Compassionate Communities Toolkit. In the Compassionate Communities Toolkit, it helps community organizations discern what the qualities of a compassionate community is and how to measure them. So that alone wasn't enough. What happens if you add the next element? Next slide, please. So tailoring for people living with dementia. What can we practically change to build capacity to be more inclusive of persons living with dementia? So the dementia inclusion movement, also known as dementia-friendly movement, that we draw upon comes from the work that was conducted in the Building Capacity program, Building Capacity in Dementia project. This project brought together researchers from the University of BC in Vancouver, Lakehead University in Thunder Bay, and other community organizations, including Northwest Dementia Working Group in Ontario, the Westside Seniors Hub in Vancouver, and most importantly, persons living with dementia. So comprising and adding the voices of people with lived experience. Collectively, this dementia inclusive project aimed to develop and evaluate ways to create sustainable opportunities and helping people remain active in their community. So one of the outputs of that project was the Building Capacity Action Guide, a very pragmatic tool to help others build support in communities to become more inclusive and dementia friendly. So that work combined with the last element, that of volunteer navigation. Next slide, please. So the final piece of this element was drawing on the work of the Nav-CARE program. Now, Nav-CARE stands for navigating, connecting, advocating, resourcing, and engaging. It is an evidence-based volunteer program where specially trained and mentored volunteers collaborate with persons living with declining health and their families with the aim of improving quality of life and enabling them to age in place at a home or a home-like setting. So this Nav-CARE program the question is, how can we best recruit and prepare volunteers to support this work of engaging a compassionate, dementia-inclusive community? The Nav-CARE program has been in development since 2010. It's supported by a strong Nav-CARE toolkit, which focuses on recruiting and preparing and supporting volunteers to do the important work that we've just spoken about. So next slide. Putting these three elements together helped us to translate then these concepts and the ideas and shape a new toolkit for each of the projects, which is called Compassionate Dementia Inclusive Communities Toolkit. It's always been a mouthful. Internally, we call it the CDIC for just our own language, but it is a whole product that is to develop a compassionate dementia inclusive approach. So this is built now as a toolkit with strong evidence, providing organizations with a practical 6-step approach to developing and implementing these initiatives. A quick overview of what is a compassionate communities approach. What does that implementation look like? Next slide, please. So there were 5 elements that were drawn out in this toolkit with these elements. Building partnerships. First of all, no organization can or ever works alone, and we want to draw on the interorganizational strengths, from which there was a co-leadership team formed, as well as an advisory committee. The second element was that of community assessment, which is understanding the communities through doing a community assessment. And who exactly is in our community? What are the needs? What are the attitudes or the understandings of who are in our community from our organizational approach, and who forms that community as members of the public? This was done through an environmental scan. The third part is the preparation of volunteers. So this is done through the Nav-CARE training and other relevant training. The existing program was already in place in the community partner organizations, and this then became the growth and the fodder for expanding the elements of training of this approach in the communities. The next step, number 4, was envisioning and implementing interventions that promote awareness, building the knowledge, spreading the understanding about dementia, and the interventions that would provide the practical support for people living with dementia and their caregivers. And the last part, of course, following this is the evaluation of the interventions and considering what would be sustainable for the future. So that's quite a mouthful. I wanted to set the foundation a little bit about what this looks like. I'm going to pivot now and just talk about some of the things that have unfolded and what we have discovered in the work so far. To let you know, actually, just as a side pause here, the program itself, this project will end in its delivery and interventions by the end of April. And so some of the work that we're still talking about is still in progress, but I'm sharing where we're at in this journey so far. So as I've noted so far, there are 6 organizations from across Canada that are currently implementing this approach. As you can see here, we have a variety. Now, 2 of the organizations are community support services. One is a health authority, and there are 3 organizations that are hospice palliative care organizations. Each of these are primary organizations now who have collectively been working with the team, and we as the team are supporting each one of the sites. We have done that through a community practice, through mentoring on a bi-weekly basis, as well as the reporting responsibilities back and forth and guidelines that are needed to be fulfilled in this project. The primary organization, so each of the 6 lead partners, were responsible then for recruiting 2 other organizations to form their leadership team. These partner organizations included, in the second table on this graph, I want to just outline that on their leadership team, there were community support services. There was a formal healthcare provider organization. There, in 2 of our sites, we have the United Way as a partner. On 2 of the sites, the partner sites partnered with Alzheimer's societies in their local province. One of the sites partnered with a municipality, and one of the sites partnered with a faith-based organization. And just to note, these sites, with the exception of Brella Society, which is located in South Surrey in an urban setting, the other sites would all be considered, 4 out of the 6 are considered rural or remote communities, serving a demographic and a population. So their partnerships were really key to augment and implement this project and their interventions. Next slide, please. In addition to developing inter-organizational partnerships, the sites were also responsible for pulling together the advisory committee. They were asked to be intentional about the representation and were very encouraged to include persons living with dementia and their care partners as part of their team. The advisory committee's responsibility was to help the leadership team meet the project deliverables. Some of our communities said, hey, we're not just advisors, we're champions, we're actually ambassadors. Because these are the people who are passionate about helping the interventions and the community rise to the occasion. So who was this representation? On the collective of all 6 of our sites, we had 33 formal healthcare providers. We had 37 persons living with lived experience, 23 community support service organizations, 10 government and municipality representations, and there were 6 other partners that were formed as part of the advisory team. So collectively, each one of the sites chose and recruited and developed relationships with community representation that would best suit and support the project. I want to give you just an example here of one of our sites, of one of the interventions. One of their suggestions was assessing their community, and this comes from Age-Friendly Cold Lake, which was our project site in Alberta. One of their projects was to assess the community, and they did so by starting with their own community mapping. They built upon their partnerships and looked to develop new ones. And so this was one of their working maps of the cross-section of their health and social care providers in their municipality, in their city, and in their region. And this helped them shape who some of the partners might be on their advisory board. Their advisory board was already an existing board as part of their other work, and so they augmented what they already have and built based on this map. This is something that has helped other sites as well to determine who they are in the context of their community and who might be some of the other representation that might benefit and jointly partner for the better of their community. We don't want to spend a lot of time on this, but we can also certainly say that there was a lot of engagement. Each site collectively did a lot of work in engaging their community, whether it was by radio or print media campaigns, their social media campaigns, distribution of a lot of print materials, participation in community events and presentations. This included wellness fairs. Sometimes it was in front of the city or the town council. It was to community groups. It was men's groups. It was faith-based groups, as well as meetings with social and healthcare providers. A lot of work is done in building relationships, and this is one way that the spread of community was enlivened through each one of the partners. Next slide. So I've touched on a little bit of the community assessment already. A lot of this is, of course, shaped by each individual community, but one of the tools that was vital that each community received was the Compassionate Community Index. Next slide, please. This is a tool that the BC Centre has partnered with in this project to share, which is Understanding the Community. This is a tool to help assess a community's readiness and commitment to even engage in such a partnership and the projects. And the BC Compassionate Community Index tool is a survey that helps a community assess their readiness based on 5 different ideals: awareness and advocacy, attitudes and commitment, leadership and capacity, networks and connections, opportunities, recognition. And so this tool was slightly modified in order to include and focus on compassionate dementia-inclusive communities. The questions were set up in such a way that can be distributed, and indeed in all this project was answered by the advisory committee, members of the community, and each site was asked to distribute this as part of an assessment of who they are and what is the understanding of the community for the readiness of this project. Essentially, it provides a snapshot using perceptions of community stakeholders and the public as the community chose to include them. Next slide, please. This is a quick snapshot then of what we discovered. This showcases the results of 193 persons who completed the survey from across all 6 communities. This is not just one community, this is a cumulative picture. What we can see here, when asked how aware or how ready is your community to engage and raise awareness and advocacy in dementia-inclusive compassionate community initiatives, what are the attitudes? Do we have the leadership? Do we have the capacity? What are our networks and connections? What are the opportunities that we have to do so? All of the results here showcase the most responses clustered around we've just started, we have just become aware of, and we are on the road to becoming and creating a more compassionate, inclusive community. So those are highlighted in the purple and the teal. The purple is we're just starting to become more aware of, and the blue is we're on the road to becoming and learning more. Now, what we see is attitudes and commitments in the second bar graph here is a real honest look at saying we're just starting to become more aware of what this might be. And then the next section under networks and connections, we see, hey, we actually have a lot. We have a lot in our community and we want to explore more. So that's a quick snapshot of some of the discoveries that the community's made and we collectively have learned ourselves in this project as well. Next slide. The data is important, but I want to also share some of the stories here. So while we looked at the Compassionate Community Index, we looked discretely at the questions that composed each ideal, and then we ranked them in order from highest to lowest. So as you can see here, the ideal, leadership and commitment, had 2 of the highest ranking questions, meaning that more people responded that they were on the road or nearly there, while the opportunities and recognitions held 2 of the lowest ranking questions. In other words, we're not there, we're just getting started. What this tells us is that perhaps organizations could leverage their strengths related to leadership and community to animate the opportunities and recognitions, such as organizing media blasts, promotions, fairs, and featuring content that was related to compassionate dementia inclusive communities. So now, based on community awareness raising activities that they've been involved in, we have seen that our sites have actively engaged in all these communities. So taken together, the results from these surveys, we indeed saw the 6 communities have benefited, their advisory boards and their interventions have grown, and this is a foundation that we have partnered with them to also help them leverage their work. We really have observed also that these communities are very eager to learn, to step up and create more opportunities for members of their community, and that there's creativity and a great commitment to creativity and sharing the learnings. It's unprecedented what we have seen in the development when a community is rallied together to discover what their strengths are and then support members in their community. And I'll be excited to share some of that in a minute. The next slide is, how did the communities implement this approach? What was their vision and implementing a plan? So each community is obviously given the breadth of creativity based on what they've discovered of who they are, where they're located, and what the needs of the community to design interventions as creatively and as necessary as they wished. Next slide. In these 6 sites, we have seen such diversity and beauty. These threads of creativity are amazing. So from organizing in this kaleidoscope, organizing large-scale interventions such as training businesses and services to providing services to be dementia inclusive. There are communities who have participated in publicity-wide campaigns to raise awareness about dementia, communities that have developed new support groups for people living with dementia and their care partners, a diffusion of dementia inclusion in all programs and practices within an organization. We've seen the Nav-CARE volunteer support rise, aligning with social prescribing processes already in existing communities, the development and expansion of bereavement support groups, one-to-one support for people living with dementia, they themselves doing journaling, the windblown support for bereavement, many initiatives of care, dementia support groups for people with young onset dementia, culturally relevant groups also located in long-term care facilities, not excluding that place or setting is anywhere people wanted to gather. There were caregiver support groups. There were activities such as exercise programs, mediboxing, art, community walks, picnics, coffee conversations, intergeneral activities, even a mini Olympics, the toolkits for caregivers, education series on brain health, persons living with dementia, and education for carers. The community learning was expansive, a dementia-friendly training for businesses, town hall sites, experiential learning for the general public, awareness campaigns, health system improvement, and partnerships and dialogues with healthcare providers, and implementation of What I Need to Thrive Form. All of these have been initiatives from these 6 sites. What is my time? Oh my goodness, I need to zip along. I wanted to get to the good stuff, but it's really important to hear some of the great work. So recognizing that our projects are not finished, here's a quick snapshot of each of our sites. The Greater Trail Hospice Society hosted an Evening to Remember. The community awareness raising event saw over 80 people attend an event, learning about dementia, learning sensory loss, what is memory making, and they came together as a community to support people living with dementia. They have a second intervention they did is What I Need to Thrive Form. This is envisioned by a care partner on the advisory committee and was redefined by the Trail team. And this is literally a form that is to communicate the care for the recipient as they go to their healthcare providers. So in other words, what are some of their triggers? What are their calming techniques? Who are they as a person, and how can the care be directed more specifically to them with dignity and respect? It is widely shared in the community and now widely is being used as an education care provider form. And that form, I hope, will be something that the community organization is going to move through their care system. Yes, lots of love hearts. Bruce Peninsula Hospice in Ontario, in Wyerton, had 15 businesses that they trained their business partners in dementia-friendly curriculum. They hosted a community gathering where these businesses opened their doors to families and carers and people living with dementia, specifically to shop on a day. It was an event that welcomed many people into the shops. One of the comments even there was, I have not been in my own town shop on my own street for many years, and this felt like a welcome coming home. They've also done a food for thought, which is an intervention in their local grocery store, raising awareness about dementia and making space for people to share their stories, to ask questions, and become familiar with what it means to be more inclusive community and attentive to people of all spaces. In Prince George, Connecting Minds to Compassionate Hearts saw 2 interventions with companion volunteers that were trained for meeting people in early stages of dementia. They met as a group. They had a ton of fun. I think this is where they did the Olympics in their own creative way. And this community then fostered a sense of a belonging and engagement for people living with early diagnosis. The caregiver support services works developed and guiding their peer connection and connecting to the community resources. Again, it tied together a network saying you're part of this community, we're here to support you, and building the resilience and the capacity of everyone to grow and expand and support. Next one, compassion and inclusion in practice in Cold Lake, Alberta. One of their initiatives was a walk down memory lane in partnership with their local Cold Lake Museum. They had a series of photos of all older memories of the city of Cold Lake. They had them printed up on large picture frame boards, 11 by 14. They had them posted in a walk on easels, and people in the long-term care community were invited to join, and the initial session there was walking down memory lane. They had many volunteers as local high school and other younger volunteers also became part of this walk down memory lane. Many more of these walks are planned because it was so well received and so deeply appreciated. They also host a grief and bereavement cafe, and they've been developing a caregiver toolkit with end-of-life care, resources, handbooks, promotion of self-care, and other resilience. They are also doing the index survey to community members again to continue to raise awareness. They've partnered in their community and have their goal was to have 200 community surveys returned, and they're well on their way for further and future initiatives. Brella Community Society, next slide please, is culture connectors and capacity building. They have integrated the social prescribing program and the community connectors program and their Nav-CARE. And so they've coordinated this to raise and coordinate their volunteer-driven initiatives to support a more cohesive interaction with people living with dementia. The caregiver support groups in partnership with the Sani Cafe, which was culturally specific dementia and caregiver support for South Asian community members that were meeting weekly. And there was a caregiver education series that was held, as well as fitness classes, which is the Medi Boxing Box to Fit, which was a real hit. And I think they've had a request for that to be repeated. And last but not least, just because it's furthest away, these Newfoundland and Labrador, they are currently in their projects with pathways to support creating compassionate dementia-inclusive communities in primary care. They are currently working to seek to co-design one clear referral pathway for primary care with their partners to standardize referral forms and to vet and upload resources to train and onboard family practices and deploy the clinical materials. As you can tell, that is a project to be had and is still in the works. All of these sites, all of these communities have been doing amazing creative work. And what we have seen overall is now the desire to sustain and the ability to sustain in the future. One last event that will be held, next slide please, will be a community cafe in their next couple of months before it closes up. And this community cafe is a celebration event. There is a support that we want and the communities want to support the people, their caregivers, healthcare providers, the advisory team, the board, the public, the community, to raise awareness, to celebrate, to strengthen their partnerships, to gather feedback, and continue to share the ownership of an interorganizational approach. And hopefully then continue to gather and connect and build relationships. Lastly, once each site has completed their interventions and the events, the project team is collecting the evaluative data and all the learnings that will be compiled. And in the future, then we will be updating the toolkit with our learnings. And then a future distribution will be made available for community organizations to pursue and to learn from the work of these community organizations. Last slide here is, I just want to say thank you for joining. I know this took a little bit longer. The resources that were used primarily here can be shared in the web email that follows this. But for now, I just want to go to the last slide and just open the door for your reflections and your questions. And I'm here to hear the journey, and I turn it over to Lisa to administer that question period now. Thank you very much.
Thank you, Melanie. That was amazing. I love the programming, and one hospice in particular, they color coordinated their outfits with the with the color theme for the event, which I thought was great.
Lots of fun.
Yeah, so we'll open it up for questions if folks want to drop your questions into a chat, or feel free to unmute yourself. Lots of great learnings here. If you're a community organization thinking about doing some of this work, you have one of the experts here to answer your questions today. Maybe I'll ask you, Melody. So what was the thing that you took away from this project that really made a big difference for you? Like, what meant the most?
One of the things in community, especially our nonprofit community service providers, is how often they work in isolation, and how often the mandate for the scope of services or the mission that each community organization has was really augmented through this. Working together with other partners is not to be taken for granted, although what I love seeing is communities discovering other community works, to see and discover the shared resources, the assets of people, the innovation, oh my goodness, the creativity. But Trail, Gail is online here, Gail Potter. I mean, they used a winery event to create a dementia-inclusive awareness event. There's no stopping to creativity, whether it was in public or with their advisory board. The creativity and partnerships grew throughout, and that was best. Now, having said that, there's bumps in learning how to work together, and most organizations had some bumps they had to sort out, but that didn't stop the direction and the intent of what they were hoping to do.
That's great. So I have a couple questions in the chat. So from Farima, please, I apologize if I get your name wrong. So she's indicated here, thank you so much for your presentation. Could you please tell us more about bereavement support offered, especially while folks' loved ones were approaching end of life?
Yeah, great question. So there was a couple of sites that held grief and bereavement support. In Brella, the caregiver support and bereavement support was around supporting people in the diagnosis, early diagnosis. It was also self-led by people living with the dementia diagnosis that they had received. There's a grief, there's a loss that embodies that journey. That is one of the groups. There was another, just going back here to Cold Lake, grief and bereavement support. There was not just for people living with dementia, but also family members and family caregivers. Some of the sites will be able to share more about that, but the grief and bereavement support is significant. Care groups, yes.
Okay, so there's some chat going on about finding a copy of What I Need to Thrive form. It looks like someone's dropped it in here.
Okay,
Okay.
Jacinta is in there, and Gail, I'm going to ask Gail to just answer and share a little bit more about that because that was from Trail, Greater Hospice.
Yes, I can speak to that. What we've discovered is when people with dementia are admitted to facility, they go into emergency, they're admitted to acute care. They're usually in crisis or they're in a stage of dementia where they can't communicate their needs very well. And so, if the caregiver can fill out the Thrive form to explain this is the best way to approach this person, this is what they like to be called, this is how to give them their medications, this is how to help them remain as independent as possible, but this is how you can support them to do personal care, etc., etc. Then that can be handed to the caregivers in each of the facilities. And they've got a head start on being able to provide dignified and calm and respectful care to that person. So the Thrive form has two pieces. It has a cover sheet that explains the use for it, and then the actual Thrive form that that's the caregiver can fill out. There is a link there, but also at the end of your presentation, Melody, there's a link to contact Gloria Praveen, and she
Correct.
has copies of that as well. So we hope it will be widely used. But when we've given it to care partners in the facilities, they've been really delighted with it.
Thank you, Gloria. Sorry, not Gloria. Thank you, Gail. um, Happy to answer any other questions or comments. Any reflections? Um, I'm assuming that those of you on this call have a desire or an interest in dementia inclusive communities. What are your thoughts or reflections around this?
So I'll just go through some of the chat questions. So from Laura, we have a question. What kind of education the organizations in Wyerton received in order to qualify as a dementia-friendly businesses?
Yeah, that's a great question. Wyerton did do a whole business training using some of the Alzheimer's Society support education, but they did create an education day in awareness, and there are more specific details that can probably be found from them directly and through Gloria.
Okay, Christine, you have your hand up. You can go ahead, please.
Hi, we're just wondering if any of these resources could be shared in the email follow-up, or if you could send a link in the chat for the Thrive form. There's a few other things that were pretty awesome as well. Like I'd be interested in the Nav-CARE toolkit,
Okay.
and um,
Sure,
there was
that's a great question. So what we can do, so the Nav-CARE toolkit has been around for about 10 years. There is a community of practice of organizations that are currently training and hosting Nav-CARE in their community. That is a link that we can add, as well as the Compassionate Community Toolkit Indicator link can be in there. The results of this project and the survey's information specifically, as I've said, is not a finished project, and we will be collaborating with each of the project sites and finding a final report probably in the next number of months. But certainly the resources that were named here are absolutely available to share.
Oh, wonderful. I really like the Compassionate Dementia Inclusive Communities Toolkit as well. And I think there was one for like a toolkit for caregivers.
Okay, we'll do our best to put it all together here. So the toolkit that was formed for this project specifically will be revamped now from our learning. So the three elements of Nav-CARE, compassionate community, and building capacity, we are reshaping that to be more reflective of what we've learned, and then that will be released as well. But the other components, yeah.
Hi, I just have a question for Gail about the Thrive form and if it was done in consultations with any First Nations entity, being that along with how they take their medications and all these specific things that a dementia person would appreciate in building in their care plan. Does it also include historical information, like where they worked, if they attended residential school, in building that care plan? Those types of things need to be considered in that thrive form. I'm hoping that it does. So thank you.
At this point, it's geared just to that personal individual. There isn't anything specifically cultural that might be applied to that person, but I think it could be added into the form. And so I would ask that when it's sent out, it be sent in a Word document form so that people can adjust it and personalize it to their own communities.
Well, that would be great. Yeah, anything too, I think that would be activating or triggering would be something good to know for caregivers, right? So if you were to bring up a certain topic that really sets them off, then that would be, probably something good to note, right? I think Christine back here in the back would also like to say something.
Yeah, I wondered if there was an inclusion of RCMP in the big picture of a community assessment, just for when community members who have dementia are sort of targeted because they behave or react differently when they're in a mobility scooter. They may not be totally road savvy behaviors. And I've struggled with the police actually waiting for my husband to show up on the street to pull him over to give him a heck for things he's doing. But I think that if their knowledge of dementia patients in the community would be helpful to be a part of that assessment.
What we have in our community is a wander registry that we can give to caregivers, and they can register their person with dementia with the RCMP so that if the person does wander or becomes confused and can't remember how to get home or who they are or even how to approach somebody, they can register with the RCMP. So I can send that to you, Melody, and if people want to copy that, and then see if they can integrate it with their RCMP detachments, that would be great as well.
Absolutely. Thank you.
Good question.
Yes.
Does anybody else have any questions? I think we're good here unless, do you have any questions? Okay. Thank you.
So I just noticed in the chat as well, is there any other consideration around supporting individuals living with intellectual development disabilities and navigating their dementia journeys? At this time, in this particular project, that has not been a part of the dialogue. However, I will take it back to our project group as one of consideration for future. So as this project comes to an end, that isn't there, but I think it's really important to know that we have people of all diversities and all illness trajectories, and that is an important one not to overlook. Thank you for bringing that up.
Any more questions people might have? Okay, if that's all for questions, we'll close the session for today. So thank you very much, Melody, for the presentation. Really great impact project. Happy to learn about it for myself. And I'd like to thank all of you for joining us today, for giving us a bit of your time. Thank you so much. So we hope that everyone enjoyed the session, and we're going to ask that you complete a short survey. It will pop up when you leave the session. Takes about 1 or 2 minutes. And for follow-up, we will be sending out the resources that many of you have asked for today. We'll send you a copy of the presentation recording as well, session summary notes, and again, the resources within the next week or so. So thank you again, everyone, for attending, and we hope to see you again at our next Echo All Together series. Enjoy the afternoon.